Well, people have been honoring Breast Cancer Awareness Month in a number of ways, and today we are by speaking with a mammographer who is also a breast cancer survivor about the importance of breast cancer screenings and mammograms. Dana Aragon is joining us this morning. Thank you for coming in, Dana.
Thank you for having me. Thank you.
First off, I wanted to ask you, you have been on both sides of the screening process. You're a breast cancer survivor. First off, I want to ask you, how are you doing?
I'm doing great. I am lucky. I feel so lucky and fortunate that a mammogram saved my life. I'm one of the 1 in 8 that gets breast cancer. So it was hard for me to believe that it happened to me, you know, being a mammographer.
Sure.
But I am so lucky. So I'm doing very well. I'm almost 3 years out from my diagnosis. So
That's
I'm
fantastic.
thrilled that my treatment has worked and the screening mammography did save my life.
That is amazing.
Yes.
Okay, so let's give folks at home some very useful information. Let's talk about the screening. How does it work? Who, I guess, who should be getting screened and who does the screening? You mentioned you were a mammographer.
Yes, I'm a mammographer. So a mammographer is a registered radiologic technologist who has specialized training in mammography. Okay. So we've gone through an education process and we've learned all about how to get the best exam that we can, the most quality exam that we can for the patient. So that's the person that will be doing the mammography screening.
Okay.
And then the machine, and I think we have some images that we can show later of the machine. So the piece of equipment that they use is called a mammography unit.
Okay.
So the mammography unit you can see here in this picture. The technologist is standing behind the screen and she's getting ready to make the image.
Sure.
This image is going to be a digital image and you can see a representation of that on the screen as well.
Okay.
And this image is a picture of a radiologist talking with a mammographer about what the exam looked like. So the top of the machine is where the x-rays will come down through the breast, hit the imaging plate, and create the digital image. And that's what the radiologist, who is a physician that's trained to be able to read these exams, will look at. He'll compare the ones that perhaps someone had from the year before, and they'll decide if everything looks okay or if the patient needs to come back for additional screening views or diagnostic exam.
Interesting. You know, I always like to ask this because I know a lot of women have this question. Does it hurt?
It depends.
Okay.
As you know, everyone's breast tissue is a little different.
Sure.
So some people do have breast tissue that's a little bit more sensitive. So we do recommend that you keep in mind when you're scheduling your mammogram when your menstrual period will take place.
Interesting.
Women's breasts tend to be a little bit more tender during that time. So it's a good idea to kind of stay away from that area so that you are able to have the mammogram and maybe not have as much.
Either way, whether or not you feel that pressure, I think should not be a deterrent.
It shouldn't, absolutely not.
Okay, and let's talk about when women should start getting these exams, and also men. Men get breast cancer. Do they have an entirely different process, or do they go through the same thing?
Yes. So the American Cancer Society recommends that women should get mammograms beginning at age 40.
Okay.
That is also what the American Society of Radiologic Technologists, the organization that I work for, that's what we recommend as well. So beginning at age 40, a screening mammogram. If you have a family history of breast cancer or if you notice changes in your breast, you should call your doctor and make an appointment and try to get in a little sooner.
Sure, sure, very important. Okay, and men, let's talk about the men.
Sure.
Is their screening process a little different?
It would be a little bit different. Men don't typically get annual mammograms. So what men need to do is do a self-breast examination.
Okay.
If they notice anything that's changing in their breast, they need to contact their physician, and their physician will decide the best course of action.
That's interesting. And I just wanted to ask you, you know, when you are talking with a patient, and let's say there is something on the screen that may be questionable, do you ever talk to them about your experience, and what kind of a reaction do you get from the women?
Well, the radiologic technologist's job is to do the diagnostic imaging. So they're doing the screening exam, and then the radiologist will be able to interpret that exam. Okay. Some of the things that we do as mammographers is we can help the patient through any anxiety that they have. So if they're experiencing some anxiety about what the next step is in the process, then we can certainly help them with that. We encourage people to ask questions if they've got questions about the technology or how things work, but anything that has to do with diagnosis will go to the radiologist.
Interesting. Wow. Okay, so the bottom line, at age 40, ladies, really is the key age where you want to get that annual mammogram. But we also talked a little bit during the break is self-breast checks are also just as important. And you
Very
don't have to be
important.
40 to be doing those. It's
Very
actually
important.
encouraged that
Yes.
you do them, frequently at any age. Really.
Yes, women can get breast cancer as early as in their 20s, and sometimes, unfortunately, even earlier than that. So it is very important for you to do a self-breast examination. You should be doing that once a month. If you notice any changes in your breast, you need to call your doctor and get an appointment with them to have an evaluation.
Also, call the doctor if you have history of breast cancer being in your family and you have not gotten that mammogram.
Yes,
done.
you should be getting your mammogram by age 40. If you have a strong family history, your doctor might recommend that you go in a little bit sooner than age 40. But you do need to be vigilant and really advocate for yourself and watch.
Interesting. Oh, Dan, thank you so much for coming
Thank
in,
you.
sharing with us your testimony and what you do and how to help others out there. For a recap on what Dana has gone over, head over to our website, krqe.com. You can also go to a link that we have there with more information. That is krqe.com. Thanks again, and
Thank
so
you.
good to see you
Thank
doing
you.
well.
Thank you.